Greetings from Bumrungrad Hospital Talks. My name is Dr. Thassanawut Dhearapanya. I am an emergency and aviation medicine doctor by training, and I currently am a division director of medical transport and also business development international. In this episode, I'd like to talk about the alternative hospital quarantine in Thailand, and especially in Bumrungrad International Hospital. Due to the COVID-19 pandemic, it is inevitable that the Kingdom of Thailand, just like other countries, is locked down under the emergency decree, and locking down meaning no one can enter the country. However, there's a permission to enter Thailand under the Royal Gazette published on the 31st of July 2020, on page 81 to be precise. Groups of people are categorized into 11 groups, while Thai being group number 1, and then foreign nationals into group number 2 to 11. And we are focusing on group number 10, who are patients seeking for medical care with their companions, maximum of 3 companions, that they can enter Thailand to seek for this kind of care. The Thai authorities imposed the regulations regarding permission to enter the kingdom, including the quarantine upon arrival. Owing to the current pandemic outbreak, regulations regarding the international travel have been put in place. Foreign nationals seeking for medical care in Thailand require the permission to enter the Kingdom of Thailand under the Alternative Hospital Quarantine or AHQ program. The Ministry of Public Health or MOPH is monitoring the numbers closely and plans to update their regulations, including the list of accepted countries, supposedly every 2 weeks. Currently, patients from certain countries around the world are allowed to submit their approval consideration to enter Thailand for medical care. A list of accepted countries can be downloaded at our website. Please check it out at worldwideweb.bumrungrad.com/en/medical-travel. We as a hospital remain ready to accept the patient to provide state-of-the-art health care as well as quarantine of the patients and their companions during this difficult time. Let me walk you through the list of documents needed for the process. First of all, you will need a copy of the patient's passport with certified signature, of course newly signed on the copy, same as the signature in the passport. Secondly, a copy of the companion's passports with certified signature, maximum of 3 companions per patient. We need also the updated medical report with relevant investigation results. 4. We need a referral letter from a doctor in the current country of the patient, stating the need to seek for treatment in Thailand. Number 5. Proof of financial status, such as bank statement. 6. We need an insurance policy or any form of the guarantee of payment, maybe from the embassy or from your company, covering the treatment of COVID-19 incurred in Thailand, including medical transportation and repatriation if needed, with a minimum amount of $100,000 each for the patient and each companion. Number 7. The affidavit of support, only used for patients with companions. This piece of document will be prepared by Bumrungrad International in attachment and then signed by the patient and or the companions. Number 8. The letter of intention and consent for quarantine. This as well will be prepared by our hospital and signed by the patient and the companions. If the flight ticket is available and you know when exactly to fly, then you let us know. But if not, then that's also fine. You can tell us later. Number 10 in the list would be a fit to travel or a fit to fly certificate issued by a licensed doctor in the current country within 72 hours before departure. But please do not seek for this item yet. We shall alert you when to visit the doctor for this certificate. Last but not least, Thailand will not accept patients diagnosed with COVID-19 just yet. Therefore, a COVID-19 test result showing negative result within 72 hours before departure is also needed. And you can imagine, do not attempt to get the COVID-19 test before the approval is confirmed. After receiving and processing the aforementioned documents, Bumrungrad International Hospital will submit a confirmation letter to the Thai authorities in order to request for a permission for the patient and their companions to enter the Kingdom of Thailand. Once approved, a copy of the stamped confirmation letter will be sent to the patient to be submitted to the Royal Thai Embassy or Consulate General in the current country. Then the patient will receive the Certificate of Entry or COE from the embassy. Once you arrive, we will get the ambulance or the van to pick you up from the airport, bring you directly to the hospital. While the protocol for quarantine in the hospital will go as follows. A patient and companion will be subject to a quarantine in Bumrungrad International Hospital for the duration of 14 plus 2 days from the day of arrival into the Kingdom of Thailand. The first day of arrival is referred to as day 0 and quarantine is completed on day 15. Therefore, it's 16 days in total. Only one companion can stay with the patient in the negative pressure room, while the second and third companions will be in a separated single room during the quarantine period. A patient will only be allowed to leave the room for medical investigations and procedures as required, while companions will remain in the room throughout the quarantine period, except for visiting the patient at certain times of the day. Fever and respiratory tract symptoms will be monitored on a daily basis. In the course of quarantine, the nasopharyngeal and oral swabs for real-time PCR tests for COVID-19 or SARS-CoV-2 will be performed on 3 occasions. First on day 0 or the arrival date, second on day 7, and then on day 14. If the test result of COVID-19 is positive, then the infected individual will be cared for in Bumrungrad International Hospital on their own expenses, under insurance coverage, and the conditions may apply. Smoking is not allowed during the quarantine. And I repeat, smoking is not allowed. Moreover, premature return or repatriation of the patient and companions is also, unfortunately, not allowed by Thai authorities. So the patients and companions have to complete the quarantine of 16 days as mentioned earlier. The approvals from the Embassy of the patient's nationality as well as the Ministry of Foreign Affairs of Thailand are needed before returning home, and this process takes about 2 to 3 days, so you have to let us know beforehand that you are going home. Last but not least, foreign nationals who is permitted to enter the Kingdom of Thailand as patients seeking for medical care can only be quarantined in the hospital upon arrival. I understand that some of you might want to seek for the comfy of the hotel stay. However, you cannot be changed to quarantine in the hotel. During the course of quarantine, you can seek for medical care and the treatment can be commenced right after you have been tested negative of COVID-19 for the first time. However, that decision would be relying on the care team to see when exactly should be appropriate to start and commence your treatment. Thank you for your attention. I'm Dr. Thassanawut Dhearapanya, Bumrungrad Hospital Talks. Please subscribe to our podcast for more episodes. Stay safe and healthy. Bye-bye.